Hi, Dr. Dyer. It's Hadley calling from the emergency department. I have 23-year-old African-American LaShonda Johnson with me. She came in complaining of shortness of breath and dyspnea after playing soccer this afternoon. She has had asthma, was diagnosed with asthma at the age of 8. She's used her rescue inhaler 4 times in the last hour. Upon arrival, her blood pressure was 165/85, heart rate was 117, respiratory rate is 28, and her oxygen sat was only 85 on room air. Upon assessment, she was also having difficulty speaking and expiratory wheezing that could be heard without a stethoscope. Recommendations, I think that we should admit her to the emergency department, get her started on oxygen supplementation, and then activate or begin treatment with a vasodilator to help open up those airways to bring that oxygen saturation up and calm the inflammation she's experiencing from her asthma. And then the second part of this week's assignment, the question this week is, how did this client's health history alter your decision on who to send to the open ED bed? In my opinion, I think that one, ABC's prioritization, airway. The other patients, one was bleeding from injuries, and the other one was having chest pain, which is also priority and important. But like we've always learned in school, you can't fix bleeding and circulatory issues if you don't have an airway. LaShonda's airway is compromised, so she seems to be the highest priority to me. It is also concerning to me that she has used her rescue inhaler so many times, and it hasn't seemed to help. So between the inhaler, the ABCs, and her oxygen saturation being only at 85, I think that we should admit her to the single ED bed due to the pertinence of her situation.